Welcome to today's HealthLine webinar from the American Association of Kidney Patients, COVID-19 Kidney Patient Planning for a Safe Holiday Season. Thank you for joining us today for important information regarding the coronavirus and kidney disease as we prepare to enter the holiday season. If you have been tuning into our webinars over the last several months, you have had access to information from AAKP's trusted federal partner, the Centers for Disease Control and Prevention, or the CDC. AAKP is proud to have the CDC as one of our long-term federal strategic partners, and we are honored to serve as an ex officio member of the CDC Health Infection Control Practices Advisory Panel. My name is Erin Kale, and I am Director of Stakeholder Operations for the AAKP. I oversee our patient education and grassroots engagement activities, including our Ambassador Initiative, which comprises highly motivated and engaged patients and caregivers around the country and the globe. These individuals have a direct connection to kidney disease and wish to raise awareness and provide support to others navigating the challenges of this chronic disease. AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. This is especially true during national emergencies such as the coronavirus pandemic. We have a great presentation today, and I'd like to turn things over to AAKP President Richard Knight to say a few words.
Thank you, Erin. And as always, I would like to thank everyone who has joined us on the call today and let you know that we certainly appreciate your concern for kidney patients and the threat that the COVID-19 virus represents to all of us. AAKP has arranged and hosted this call today because for 50 years we have served as an independent voice of patients, and we take our role in educating patients and providing insights into their concerns to policy leaders very seriously. And as we all know, COVID-19 has been a serious threat to all Americans, especially those with underlying health conditions who are immunosuppressed, like myself and my fellow kidney patients. I certainly pray for anyone who has had to deal with this virus and pray that you have successfully survived it. I'm also asking all those who are listening to stay connected to AAKP. We want you to share your involvement in our online efforts, because while our reach is growing, we believe we need to educate more patients on how serious this virus is and the threat that they face. A quick recap. In 2020, AAKP's volunteers, we enhanced our organization's national and global reach. How do we do this? We accomplish this via our unique virtual platforms, developing international patient group partnerships, writing clinical journal editorials, use of television, radio, and of course, traditional social media. And most importantly, our ever-growing Patient Ambassador Initiative. We are flattered by the growing number of ambassador programs, quite frankly, throughout the patient arena. But the uniqueness of AAKP's Patient Ambassador Initiative initiative continues because it is led by patients who are an integral part and the voice of AAKP. As COVID-19 pandemic evolved this year, AAKP had the foresight to change all of our 2020 events to free virtual access, prioritize COVID-19 topics, and we implemented strategies to involve a wider audience. In the past 8 months, AAKP has broadcasted COVID-19 insights through 1 global and 2 national virtual events, a dozen webinars, and launched advocacy campaigns to highlight disparities in minority and kidney patient representation in COVID-19 clinical trials and vaccine distribution protocols. AAKP leadership has participated in numerous webinars discussing remedies for disparities in the areas I just highlighted. Viewership for 2020 AAKP programs now exceeds 80,000 people across 70 countries and is growing rapidly. International and national program faculty has included 90 medical practitioners and researchers and 60 patient experts. Again, patients are a critical aspect of how we educate each other. The AAKP Global Summit on Kidney Innovations, which was conducted in partnership with George Washington University School of Medicine and Health Science, alone reached over 20,000 patients and professionals worldwide in July of 2020. I will now ask my fellow transplant recipient, AAKP Chair of Policy and Global Affairs, Paul Conway, to talk about survey research that led in part to this call today. Paul serves as the AAKP liaison to the CDC Health Infection Control Practices Committee, HIPAC for short. Paul, take it away, please.
Hey, thank you very much, Richard. And I'd like to thank everyone who's shown a concern for kidney patients and the threat of coronavirus and who has joined this call today, especially to the families of those who have most been impacted by kidney disease. This is a very challenging time for the country, for our medical professionals, and the kidney community. As America prepares for the start of the holiday season, families that have a family member or a relative living with kidney disease, managing dialysis, or living with a kidney transplant and the drug routine of immunosuppression that comes with it have particular concerns. This is absolutely true in multi-generation households and for parents who not only take care of their children, but also have the dual responsibilities of caring for an older parent or an older relative, or that have an older relative living with them, or in an assisted living facility or a nursing home. AAKP has been very, very sensitive to patient and family concerns about COVID-19, and each one of the webinars that we have produced and our educational programming has been the result of extensive surveys and feedback from the very patients and families who have been impacted by COVID-19 and their concerns. If you take a look to our Center for Patient Engagement and Advocacy in our research abilities, we have very fine tools in survey research that we've been using to gain particular insights from patients and their families on COVID-19 and other related issues. Our current survey that's in the field has revealed some initial insights relative to this discussion today. If you take a look in the top left, it's a comparative concern indicator from March to now in terms of how people perceive risk of COVID-19. And you can see that 79% of the individuals that we've surveyed over the past 7 days have indicated that they believe that their concern about risk is higher now than it was in March. If you take a look down on the lower right side, you'll see an interesting similar piece of data about concern. On this particular slide, we've asked the question of how many people inside a family or a circle of friends have been infected by the COVID-19 virus. Now, we're not saying that this data is necessarily perfect, but it has involved a tremendous number of patients. And you can see that 41% have indicated that they know somebody or somebody is in their circle or family that's been infected by COVID-19. If you take a look at the next question, we were trying to plumb out results in terms of what the practical impacts have been about layoffs and job loss. And you can see that nearly 1/3 of those kidney patients and families that we're talking to have actually experienced that inside their household. That's interesting for a couple of different reasons, because of the implications for income, for the ability to secure food, to take care of housing, and also for care implications and stress. So then, to get into the particulars of holiday season, you can see the number of people, nearly 75%, who are indicating that they're preparing differently for their holiday season. And then you can also see some direct comments down here at the bottom in terms of the changes that actually people are making. Decisions not to travel, telling people not to visit who are in the family, the use of virtual technologies for holiday celebrations, and the number of individuals who are indicating that they're going to avoid retail stores, 68%. In this slide, it shows how many kidney patients and family members are using delivery services, 79%. And so what this means to AAKP and to our patient members is, of course, COVID-19 has been a significant concern, but the concern has actually increased in terms of people's risk. And it also indicates that kidney patients and their families have been following expert guidance from medical practitioners, as you'll hear today from our good friend Jeff from Rogosin. But it also means that they're changing plans. And how do you do things now safely during the holiday season to make certain that the risks that you've been working so hard to avoid, that you can maintain that and that your families can maintain that, so we can get through this period of time safely. On this slide, you see a number of different efforts that we put out on social media to educate folks. We have a very good suite of webinars to choose from and information that has come from our national and global events. We encourage everyone to take a look at those and to follow AAKP, as Richard Knight has indicated, on social media. And when we send out surveys, please take advantage of them, because the surveys that we do, the unique insights that come from patients, we share those with lawmakers on Capitol Hill, with officials across the executive branch, and now we will also be sharing this data during this period of transition with the Office of the President-elect, so that they are aware of the unique concerns of kidney patients. Thank you very much again for joining us. Back to you, Erin.
Thank you so much, Paul. I'd now like to introduce Dr. Jeffrey Silbersweig. Dr. Silberzweig is the Chief Medical Officer of the Rogosin Institute, a nonprofit dialysis provider in New York City, managing 9 dialysis facilities and caring for about 1,500 patients with end-stage kidney disease, 5,000 patients with kidney transplants, and 20,000 patients with chronic kidney disease. That's a lot of people. He is an attending physician at the New York Presbyterian Hospital and an associate professor of clinical medicine at the Weill Cornell Medical College. He is the co-chair of the American Society of Nephrology's COVID-19 response team. Thank you so much for joining us today, Dr. Silbersweig, and I turn things over to you.
Thanks very much, Erin, and thank you for inviting me to join you all here today. I hope that we're able to provide some information and reduce some of the anxiety surrounding COVID. So some of the topics that I'll talk about today include the fact that the second wave of COVID seems to be milder than what we experienced in the spring. I'll talk a bit about the combination of flu and COVID as we're starting to see in this fall and anticipate seeing in the winter. And then I'll talk about self-protection and the restrictions that we're currently experiencing and what the future of them might look like. I'll then make some comments about COVID vaccines, when they may be available and how we're going to get them out to patients. And then finally, I'll conclude with some comments about how we might celebrate the holidays this year. So the second wave of COVID-19 is now here, as everybody knows. It's spreading very quickly across the country. I liken it more to a sports stadium wave than to an ocean wave, in that the sports stadium wave moves in different places throughout the stadium, but it never quite ends. And that's what COVID has felt like. It quieted down a little bit for a while when it was across the stadium, and now it seems to be getting louder again. The data suggests that the transmissibility of the SARS-CoV-2 virus, the virus that causes COVID-19, has not changed. The reason that we're seeing changes in who becomes infected is that there are more young people being infected. And that has a lot to do with increased exposure in the schools, as well as the fact that most adults are now taking appropriate precautions as we've learned about how to protect ourselves from this disease. So obviously the precautions that everybody knows about include social distancing, mask wearing, and hand hygiene. Data suggests that COVID-19 is less severe. The reports suggest that mortality is less and that a smaller proportion of patients are being admitted to the ICU. Now, that said, some of the states where there are very hot areas of infection are seeing full ICUs, so there are patients getting sick. It's not entirely clear why COVID-19 seems to be less severe. Some of it clearly has to do with that we're managing the disease better, and I'll get back to that in a moment. In general, the risk factors for COVID-19 have not changed significantly since this all began in February and March. Kidney patients are definitely still at risk of both getting the infection and, if they become infected, of getting severe illness. Some of the risk factors that are common to kidney patients that may not be as common in the general population include exposure in dialysis facilities and in shared rides getting to the dialysis facilities, immunosuppression both for patients with kidney transplants and some of those patients with other causes of kidney disease like glomerulonephritis, high blood pressure, which seems to relate to COVID-19 infection, diabetes mellitus, also relates to infection and seems to impact outcomes, increasing age, which is common in the kidney population, and also seems to correlate with poor outcomes, and heart disease, which obviously can make patients more susceptible to complications. So why does COVID-19 seem milder? Why does it seem to have gone from this very large infectious virus to a smaller one? Clearly, more testing leads to earlier diagnosis so that we're managing patients with COVID-19 when they're not as sick. As I mentioned earlier, younger and healthier people are getting infected, so they do seem to have less severe manifestations of disease when they become infected. Importantly, we have better understanding of the treatment of those patients who do become infected with COVID-19. So we better understand how and when to use steroids. Antiviral medications have now been approved specifically for the treatment of COVID-19. We have better understanding of how to provide respiratory support, specifically positive pressure ventilation, which was initially considered not to be warranted for patients with COVID-19, is now common in those patients. And finally, the use of IV fluids. In the early phases of COVID-19, patients were frequently treated aggressively with IV fluids because of low blood pressure. That then led to fluid overload and may have contributed to some of the poor outcomes. Now that we have a better understanding of the causes of that low blood pressure, physicians are being less aggressive in giving IV fluids, and that may contribute to better outcomes. In addition, staff are better prepared and better able to manage patients with COVID-19. As a result of earlier testing, some of the patients who were infected with COVID-19 are able to be managed outside the hospitals, which means that hospitals can concentrate their resources on those patients who are more severely ill. COVID-19 and the flu feels a bit like a head-on car crash. Both diseases have similar transmission and similar risk factors, and in fact, for early COVID-19 or milder disease, the symptoms can be very similar. Importantly, flu affects the immune system. That makes COVID-19 infection more likely, and it also means that if somebody gets infected, it's likely to be more severe. If an individual becomes infected with both COVID-19 and the flu, the co-infection will worsen the lung function and may significantly contribute to worsened outcomes. In addition, confusion between the two could lead to the wrong treatments, so that antiviral agents that are directed specifically against the flu might be used in patients who actually have COVID-19 and vice versa. The combination of both illnesses can further increase the pressure on the resources to care for patients. So patients are often hospitalized for flu during the winter. And so if there are more patients in the hospital with flu, then there is going to be more pressure on the resources to care for patients with COVID-19. Finally, infected staff who may have the flu are not able to care for sick patients, whether they have flu or COVID-19. Ultimately, the best way to protect yourself is prevention. As they say, an ounce of prevention is worth a pound of cure. The flu shot is readily available and should be considered by everyone. Flu shots are available in dialysis units, physicians' offices, and pharmacies. Nearly everyone should get the flu shot. Some people believe that they get the flu from a flu shot. That's simply not true. There is not enough flu virus, active virus, in the shot to be able to get the infection. Among the only people that should not get a flu shot are those who are allergic to eggs, because the vaccination is built in eggs. Finally, there are some concerns that have been discussed, particularly on social media, about neurologic symptoms and autism developing from the flu. Those concerns are dramatically overblown and may in fact not be true at all. What can we do to protect ourselves from respiratory viruses? Hand hygiene is simply the single most important thing that we can do to protect ourselves. And we should use soap and water or alcohol-based products. When you use alcohol-based products, you should make sure that they're completely dry when you rub your hands together before you consider your hands sanitized. When you use soap and water, you should rub your hands thoroughly with the soap for at least 20 seconds until you're sure that your hands are clean. You can remember that 20 seconds by singing happy birthday to yourself, because that lasts for about 20 seconds. As shown in the photograph here, you should cover your cough or your sneeze into your elbow rather than into a handkerchief. It better protects the viral particles from being spread. As an individual, you should minimize your contact with frequently touched surfaces. So you should never touch your face after you touch rails, chairs, or toilets. If you need support, rather than using rails, you should use a cane that's your own private cane, so that you're not at risk of sharing germs with anybody else or getting germs from somebody else who may have touched a handrail. Gloves can reduce the risk of getting a respiratory virus, but if you're going to use gloves, you should change them and wash them often. After touching any surface, you should wash your hands or sanitize your hands before touching your face, food, or anything else. Factors that are well known to be protective from COVID-19 include social distancing. The CDC, as you all know, recommends maintaining at least 6 feet distance from people that you don't live with. Some have said that greater distances may be better because viral particles may be able to survive 6-foot distances. Obviously, this becomes more difficult in the winter when we're spending more time indoors. And that leads to the particular benefit of masks, which can reduce the risk of transmitting an infection if somebody in the room has the infection. It's recommended that masks should be used at all times that you're outside your home. Cloth masks are effective, but surgical masks may be better. The specialized N95 and KN95 masks are effective, but they require special fitting in order to be effective. Otherwise, there may be gaps around the mask that may allow viral particles to escape. In terms of COVID-19 vaccines, as everybody knows, there are 2 vaccines that have now shown efficacy in the general population. Those vaccines are now getting to the point of applying for FDA emergency use authorization. An important question is how the decisions will be made regarding approval of these products and their distribution. As we all know, politics has played an important role in the management of COVID-19 to date. And it will be very important as we go forward for the politicians to determine if they're going to make the decisions about distribution or if they're going to leave that to science and to the physicians. personally, I'd really prefer that the scientists and physicians, the CDC, the FDA, and the like, make those decisions. As you know, approval of any medication or vaccination by the Food and Drug Administration requires data showing that a medication or a vaccine is both safe and effective. Much of the safety data comes quickly, that is within a month of vaccination. So if somebody doesn't get a significant illness, doesn't have neurologic symptoms, etc., that suggests that it's safe. On the other hand, some safety data can take significantly longer to become available. So that is why most of these vaccines will go through an emergency use authorization, and I'll talk a little bit more about that in a little while. In terms of effectiveness, what the two vaccines that have been in the news recently have shown is that fewer individuals who get vaccinated get infected compared to those who receive a sugar water vaccine, a placebo. Some of the vaccine trials look at antibody production. There is some debate in the scientific community if the presence of antibodies actually indicates protection against infection with COVID-19. Additionally, the level of antibodies may be important, like it is with hepatitis B. We simply don't know enough about that at this point. As you may know, there are 6 vaccines currently in development. All are in phase 3 clinical trials, which means that they've been found to be safe for use in individuals who have no signs of illness and in early follow-up don't develop severe complications. Phase 3 trials are the final trials that are required to apply for authorization by the CDC, or by the FDA rather, to distribute the vaccines. It's important to note that most of the trials conducted to date have excluded individuals with suppressed immunity, including kidney transplant recipients. The trials do not specifically exclude those receiving maintenance dialysis, but they're not making a specific effort to enroll those patients. So it may be difficult for us to interpret how these vaccines will work in patients with kidney transplants. Again, I'll talk more about that in a moment. The vaccines will likely initially receive emergency use authorization, which simply means that they're more likely to be beneficial than harmful. Final approval will likely take months to years after completing the phase 3 trial to wait for complete analysis of the trial data. So what does all of this mean for kidney patients? It may, again, be difficult to extract the data from the general population to kidney patients. We have seen with other vaccines that responses in kidney patients may not be as vigorous as they are in the general population. It is generally recommended that kidney patients receive high-dose flu vaccines rather than standard dose vaccines, and many kidney patients have to receive booster doses of hepatitis B vaccine in order to achieve immunity. Additionally, there may be different risk of side effects, as we see with many medications in kidney patients. Vaccines will likely not be available in the dialysis centers, particularly the Pfizer vaccine, which requires storage at minus 70 degrees Celsius temperatures, and that storage is simply not available in most dialysis centers. This means that patients will need to discuss with their doctors and with the hospitals who administer them rather than in the dialysis centers, although I'm quite certain that a lot of information will be available in the dialysis centers. Obviously, as we gain more experience, more information will become available. So the holiday season in 2020 will obviously be different from any holiday season we've ever experienced. Kidney patients should consider having a supply of masks, gloves, food, and medication so that if there is illness, either among the kidney patients or among those that help them, they have enough supply to get by. Definite advice that we can give to kidney patients, and frankly to everyone, is to limit gatherings, especially indoors, to wear a mask outside your home, and to sanitize your hands often. Some suggestions are to avoid eating and drinking during gatherings, particularly if you're in a party or in a gathering with people that you don't live with. Taking off the mask, particularly if it's for an extended period of time, to eat or drink risks spreading germs, so it should probably be avoided. Consider bringing food in if you're having a gathering so that you're not bringing in food from a variety of different homes. Limit travel, particularly to those areas of high infectivity. Even if you've tested negatively before traveling, if you're in an area where there's a lot of infection, you're putting yourself at significant risk. Similarly, having visitors come to your home, particularly if they're coming from areas of high infectivity, risks that they bring the infection with them. Recent data have shown that even patients who test negative and have the infection may develop a positive test 2, 3, 4, 5 days after the initial test, so that it's possible that somebody who's traveling to visit with you has an initial negative test, but in fact has COVID-19. Finally, if possible, it's probably safer to travel by private car than to travel by bus, train, or airplane. I will stop there, and I'd be more than happy to take questions.
Thank you so much, Dr. Silbersweig. We do have a few questions, and if anybody has another question as we're going through this, please type that into the question box, and they will be queued up to be responded to. So first question here is from someone who received their kidney transplant 3 years ago. Their transplant nephrologist said their son can fly from California to see them in Florida for Christmas, and he will get tested before he flies. What precautions should they both take when his son visits him in December?
Sure. So that's a great question, and I think a very important question. I think it's a great idea to be tested before you travel. As I mentioned earlier, there is some risk that even with a negative test, an individual can be infected. And if the individual is flying, clearly there's some risk of being exposed to COVID during airplane flight. Again, I would certainly recommend that the traveler wear a mask at all times through travel to the airport, during the time at the airport, during the airplane flight, and during travel to the home of the person that they're going to visit. I would encourage not eating meals on the plane if possible. I realize that the flight from California to Florida is a long flight, so that may not be a reasonable thing to do. But if possible, it certainly reduces the risk of infection. On arrival, I would recommend getting retested 2 to 3 days after arrival. During the time that you're visiting together, certainly in those first few days and ideally throughout the visit, I would recommend maintaining as much distance as possible or keeping the time that you're real close to one another short. And I would recommend use of masks, again, where it's reasonable to do so.
Thank you. Another question surrounds traveling by car. What are some precautions to take when traveling via auto and requiring an overnight stay in a hotel?
Yeah, so that's a real important question. In traveling by auto, ideally, some people say that it's best to minimize use of public restrooms, not only because the COVID-19 virus, the SARS-CoV-2 virus, can live on surfaces and therefore could live on faucets, toilets, towel racks, etc. But because apparently the virus can, at least in small amounts, be present in the excrement of people, and so may get into the toilets themselves. I think that the risk of transmitting the virus there is rather low. But if possible, I would certainly recommend avoiding the use of public restrooms. In terms of meals during travel, I would certainly recommend getting your food and bringing it back to your car to eat to reduce exposure to other people who may have the virus, knowingly or unknowingly, who are traveling. In terms of overnight in a hotel, hopefully the hotels have all taken precautions in terms of sanitizing the room. That said, I think it would be a good idea to carry either the sanitizing wipes with you or to carry a bottle of sanitizing spray and to wipe down touch surfaces, so chairs, bed rails, toilets, sinks, etc., to help ensure that any virus that might be present is killed.
Thank you. I have another question about disinfecting takeout containers, or if you have any other recommendations on how to handle carry-out meals, or if somebody is bringing in a meal to a small gathering, what would you recommend?
Sure. So I'll broaden that question slightly to talk a bit about supermarket food brought in from the supermarket as well. There was an initial recommendation or initial suggestion that any food brought in from a supermarket or takeout from a restaurant or grocery store, that the containers should be wiped down with sanitizing wipes or with germicidal sprays prior to putting them away. Some of the more recent information that I've seen suggests that that may not be necessary. I personally believe in being overly cautious, and so it might not be a bad idea to wipe down the containers. If you're using cutlery, forks and spoons that are provided by the restaurant, if they come in a sealed plastic package, then there's really not any concern for infection. That package has been sealed up and so shouldn't be at risk of transmitting any virus. But if you're using silverware that's provided, just separately, again, I might wipe that down before using it.
Thank you. And expanding on that to gifts, one person says that their friends laugh at them because they leave their packages out for a few days before bringing them inside. So if somebody drops off food or even some type of gift for the holidays, what precautions should they be taking?
Yeah, I think that's a really difficult question to answer because, of course, you don't want to make anybody feel badly by not accepting a gift graciously. At the same time, depending on how well you know the person, if it's an individual who's giving you a gift, and particularly if it's food, and that food is not covered so that you can wipe it down, it certainly runs some risk. The hard part is that in looking at food, you couldn't possibly tell whether there was viral infection there or not. So again, I think it's important to be cautious, and I certainly would recommend limiting food gifts this year, although I know that cookies, for example, are such a common part of gift giving at this time of year that it makes it very difficult for all of us. In terms of other kinds of gifts, again, I think that it depends on what the gift is. I certainly don't blame anybody who would leave a package sitting outside for a couple of days because it's said that the virus can't survive more than a couple of days. So that would give you that additional protection. And then again, as we were talking about with packages of food, I would certainly think about wiping it down before bringing it into the home.
Great, thank you. We have one person who says that their Thanksgiving plan is a short brunch outside with masks. It'll be 4 people together, 2 of whom have public jobs, 2 of whom are transplant recipients. How do they eat together safely? I know they mentioned wearing masks, but once they're eating, are there any special precautions that you suggest?
So I think that the safest way to handle it is to sit a distance apart if space will allow that, so that you maintain a 6-foot distance among each of you. But obviously, yes, you'll have to remove your mask to eat. I have not seen any data as to whether there's any benefit to not all eating at the same time, and whether there might be some way of alternating who wears their masks while the group is eating. and that might reduce the spread a bit, or risk of spread.
Great, thank you. Another question just came in. They said, my mother lives in a condo where the condo association has a group that still plans to do caroling outside resident rooms of older folks. With singing going on, will the air outside her door be risky? She is kind of concerned about this.
Yeah, I think it's a really good question. I think it's lovely that people want to share carols, and I think that's a beautiful tradition. But there is data suggesting that singing does increase the risk of spread. Obviously, you need to enunciate your words when you sing, and so the distance that virus particles might travel is a bit greater. I would suggest not having the carolers come right up to the door, but maintaining some distance, and then ideally wiping everything down as soon as possible afterwards, so that if there is viral spread there, it can be mitigated. And even some of those aerosolized sprays that you might be able to use, antiviral sprays, might be a good way to start with cleaning after the carolers are left.
Great, thank you. These are really great questions coming in, and I appreciate your comprehensive responses to them. We have a number of questions that are coming in now regarding the vaccine. So I think there's some overlap with some of them, so I will read all of them, and hopefully you can respond. So one question is asking if it's known when a vaccine will begin to be tested in transplant patients. Another question is about the danger. Is there any danger for transplant recipients to take the vaccine? And will they be included in the high-risk early vaccine population? And then another question is asking when we will know that it's safe for transplant patients to get the vaccine. Will it be risky to take a vaccine that has not been fully tested? So hopefully you can provide a little bit of response to these questions.
So I'll try, Erin, and if I miss any of the points, please just remind me.
Sure.
In terms of getting the trials done in transplant recipients, I think it really gets back to what Richard and Paul spoke about earlier. I think that it requires all of us working together and going to lobby the CDC, the FDA, and the manufacturers to get those trials done, both in transplant recipients and in the larger population of kidney patients. I think that's critically important. I think it's a terrible oversight that's been conducted so far. In terms of the safety of the vaccines in transplant recipients, it's honestly really hard to judge at this point because we just don't have any data. As you all know, transplant recipients' immune systems are somewhat suppressed. The first two candidate viruses, the vaccines, the Pfizer vaccine and now the Moderna vaccine, are made from RNA. They're not made from live viral particles. So I would think that reduces the risk to patients on immunosuppression because there isn't any active virus there that could cause infection. I would certainly encourage you to talk with your transplant programs and ideally with infectious disease doctors before going ahead and getting the vaccine. In order to know that the vaccine is safe, there's no doubt that the only way to know for sure is by doing trials in individuals with similar conditions. And again, that applies both to patients with kidney transplants who are on immunosuppression, as well as to kidney patients who are on dialysis. And then I think there was a question about when the vaccine may be available and when it may be distributed. So it's my understanding that both Moderna and Pfizer are going to be applying for the emergency use authorizations by the FDA in the next couple of weeks. based on everything that the politicians have said, I would imagine that the approval would come shortly thereafter. So it would be my guess that we will have emergency use authorizations for one or both of these two candidate vaccines before the end of the year, so over the next 4 to 6 weeks. How quickly they will then get to distribution, I don't know for sure. It's my understanding that the Pfizer vaccine was developed outside of the president's initiative, and I can't think of the name of the initiative at the moment, Operation Warp Speed. So it's my understanding that the Pfizer vaccine will be distributed through Pfizer's own channels. The Moderna vaccine was developed through Operation Warp Speed, so that would then be distributed through the government's agencies, whether they be civilian or military agencies. So I would hope that we will see it start to get to communities and to physicians by the end of January to the beginning of February.
Great, thank you. I think that touched on all those questions I threw at you. We have a few more questions that came in going back to preparations and how to take care of oneself after going out. One person is asking if they still need to change their clothes when they get home after being out at the grocery store, for example.
So I think it really depends on the type of exposure that you have. If you're out at the grocery store and everybody is masked and nobody is coughing, there's probably not a need to change your clothes afterwards. If you're out for a more extended period of time and or there's somebody that's coughing, if there are significant numbers of people that aren't wearing masks, then it's probably a good idea to change your clothes when you get home.
Great, thank you. And it looks like one final question that came in. This person thanks you for your very helpful answers. They said they're a transplant recipient, and every year they get together with some friends to do a quick run into various stores on their lists to pick up gifts for their circle of friends. They make a game of it to see how fast they can do it. Do you recommend that this person not participate?
So it sounds like a lovely tradition. As the survey data that Richard showed earlier suggest, a lot of people are avoiding going into retail stores this year. I certainly think that that's the safest possible method to take. On the other hand, I think that if you're doing a quick shop, if you know what you're going in for, if you're masked and if you sanitize your hands, it's probably okay to go ahead and go into the retail store. On the other hand, if you're gathering with your friends and you're having a celebration and taking your masks off and risking exposure that way, I'd probably recommend skipping the event this year. Great.
Well, thank you so much. These were wonderful questions from our audience, and you have provided really great responses that I think will be helpful as people are preparing for their holiday celebrations.
It was my pleasure. I enjoyed it very much.
Great. Again, if there was a question that we did not answer during this webinar, please feel free to email us at info@aakp.org, and we will work with Dr. Silbersweig to provide an answer. I have a few closing slides to go through. I want to share with you about becoming a free member of AAKP if you are not already. We offer free membership to patients, family members, and living kidney donors. You can join online or by giving us a call on the phone. And to receive all the benefits of membership, please be sure to include your email address when you sign up, and you'll be notified by email when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make meaningful impact to improve lives. We encourage you to respond to our flash surveys, like the ones that Paul mentioned earlier, and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney disease care. You can also select to receive any of our 5 electronic newsletters and subscribe to our printed magazine, AAKP Renal Life. We also encourage you to follow us on social media for all the latest news and announcements. AAKP is dedicated to helping patients understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and caregivers. By visiting our website at aakp.org and clicking on the AAKP store button at the top of the homepage, you can find a variety of educational brochures and online tools that you can order or download. You can also order materials by phone. AAKP holds a number of events throughout the year, and these events are live streamed and recorded. Please visit our YouTube channel to watch presentations from the 2020 Global Innovation Summit with George Washington University, our annual policy summit, and our national patient meeting. I'd like to remind everyone that this webinar has been recorded and it will be made available on our coronavirus resource page. For more patient resources on COVID-19 and to listen on demand to today's webinar or any of the previous webinars we have hosted regarding COVID-19 with our strategic partners like the CDC, please visit this page on the AAKP website. You can access it from our homepage by clicking on the red coronavirus information button. I'd again like to thank Dr. Silbersweig for sharing with us important information to consider about COVID-19 and keeping your family safe during the holiday season. Again, if you have any additional questions about what you heard on today's webinar, please send them to info@aakp.org and we will work to respond to your questions. Thank you again for joining us today. Be informed and stay safe.